In today's video, I'm going to be talking about two interesting charts and what do we actually do with these. Now, before I do that, let's talk about how you can connect with us. If you're local, call us at 618-288-1489. If you're not local, that's okay. Go to our website at visionforlifeworks.com and you can do a couple of things like read some testimonials, learn about what we do, take a quiz. Oh, and you can also schedule a consultation by clicking a button. Okay, now let's talk about these two charts and what do we do with these? Well, one is a kid-friendly version, which you might assess. It's this one. So it has some little pictures on it. And then this is one that maybe is more appropriate for adults. So we can use this one for kids too, but clearly if we've got kids who are not of reading age, this is the more appropriate one to use. And so what this is it's a peripheral recognition chart. Now, in particular cases, maybe we're talking about a case where someone has a condition called esotropia, where the eye is crossing in. Maybe they have had a traumatic brain injury and they've lost some of their peripheral vision, or maybe they've had a stroke and they've lost some of their peripheral vision. This is another very useful activity that we can do with them. And again, age appropriate charts depending upon how old they are. But what they do is they'll focus in the middle here. There's a little bitty teeny tiny dot right in the center, and they will focus in on that. And then their job is to try to see the letters out in the periphery. So initially they may be looking at this and trying to see, can they see the letters just right around the inside of that circle? You can see they're pretty small. Of course, they get bigger as we go out because out in our periphery, we don't necessarily have the ability to see those teeny tiny small letter details that we do right in our kind of like right off of our central vision. And the same thing goes for this chart right here. When we're talking about kids, we've got little bitty tiny things in the middle here. So right off of that central dot, they would be trying to focus and see those. But you're not focusing on them. You're focusing on the dot and trying to see like this. Is it an airplane? I'm trying to look through the card to see it. No, it's actually like a little shopping cart right here. So they're trying to be able to see that. This is actually the first little section here, and then this is going out. And so you can see as they get bigger and bigger and they're going outward in that circle, that it would be easier in one way because the object is larger, but challenging in another way because it's farther out in the periphery for them to be able to see. So this is a good one to do if you need to help someone with peripheral grounding, like in esotropia, or again, in a patient who's had a traumatic brain injury or a stroke where they've suffered some vision loss. And this could be an activity that you do with them. Now, it can be helpful in other cases too. So for instance, maybe a patient who has problems with driving and dizziness and disorientation, or like kind of like vertigo, or problems with that vestibular ocular reflex and coordinating information that they see and how the brain processes stuff in motion and movement. So this could be a good one because it might help stabilize their periphery. So this is used in a lot of cases. But in addition to this, we're also going to be in phase 1 and phase 2 utilizing syntonics or neurological light stimulating filters. That's the part that's really going to help start turning the brain on to function better with the visual system, in addition to some of the hands-on types of activities that we would work on. Now, if you haven't done so already, make sure to hit the like button and subscribe to our channel. And for certain, call us if you have feel like that this is something that could be helpful to you. 618-288-1489. If you're not local, that's okay. Go to our website at visionforlifeworks.com. And as always, if you think this video is helpful or could help someone that you know, please pass it on. Thank you.